guys. I know I haven't updated in a couple months. I've been really busy. I started my master's program, which I'll be over with in about 2 weeks here. So I just kind of want to give you an update. Since I last posted, I have fully recovered from my radiation. I can eat again, thank goodness. All I have is a little discoloration of the neck, but from the outside you can't see the tumor anymore. And I had scans done 2 weeks ago, and it showed that the tumor had actually shrunk, and it's probably still going to shrink. So that is a positive. I know you're looking at my chest right now like, oh my gosh. This tumor is actually, they think that it's grown just slightly. It does look like it's a lot bigger, but because of the drug trial that I'm on, it's not a chemotherapy, it's a inhibitor that triggers my immune system to start working. So when I push on it, it is actually not solid, it is just kind of swollen, and that is one of the side effects for the treatment that I'm on, and it swells the tumors because it's triggering my body to recognize that there is a disease and something that doesn't belong there. So it's my body trying to fight it off. And this is the only one that has actually really swelled up. The other ones have hurt a little bit, like the one in my leg or my pelvis. It hurts sometimes about 2 weeks after I have my treatment, but then it goes away after like a couple days, so it's only sore. The only medication I take is like ibuprofen for it, and I've actually gotten more sensation back in my foot, which they didn't think was possible because technically I'm not supposed to get any sensation back because my nerve was fully pinched. And with this tumor growing, they're just going to keep monitoring it because it's not pushing on my lungs or my heart. It's not obstructing an airway. It's on the outside. It's more of a visual tumor. So if it does grow and it's not swollen in the next scan that I get in a couple weeks, they'll most likely just take me off this drug trial for a short period of time, do radiation, and then start it all over again, and then they'll monitor it that way. 2 weeks ago I had my last biopsy done, a follow-up from the first one, and it did not go the greatest because I kind of had a panic attack on the table. I've noticed that becoming more anxious when I go to get my results from my previous scans because it's about this time every year that I'm diagnosed with a new tumor area, which usually it has me going into doing chemotherapy again, which is a huge process of anxiety and some issues I have about losing my hair, and it just changes me physically as a person. So I have that anxiety every time I go in for a scan. And this time I had gotten an infusion done on a Wednesday, and then I had my biopsy done on a Monday, which is really close together, and I have never had that done before. So I'd been at the hospital for about 3 out of the 7 days of that week. So I was already sick of being there, and I didn't really feel confident in the student doctor because he was he didn't show himself as he was confident. I could see that he was nervous to do it. And I always let the student doctors do it because I think that they need to practice in order for them to become better physicians and treat other people. And I am okay with being the guinea pig for that part. During the biopsy, I lay flat on a CT table because they put you in and out of the machine through the process to make sure that they're only taking diseased tissue and not healthy tissue. So I'm awake, and the student doctor had given me my numbing medication too early, and by the time he had gotten started to actually remove the first piece of tissue, I had actually felt every single thing that he was doing. Usually you just feel a little bit of pressure, but I could feel the tube that they put in to make sure that they just don't puncture through the skin more times. I could feel the whole process. And during that time, the resident doctor had to scrub in, and another person had to scrub in to assist with the procedure, which didn't happen the first time. So it caused a lot of anxiety, and it actually triggered a panic attack. And my panic attacks are, I cry uncontrollably, and I'm not really that big of a crier unless it's like a sappy movie. And my body shakes uncontrollably. And for a biopsy to be done, you have to be completely still. So this biopsy took about an hour and a half compared to the first time where it only took a half an hour. And it was very painful for me. The recovery time was a lot longer. My back is still sore from it. The tissue was different though, and that's the important thing, is that they saw that the structure of the tissue was different, even physically, when they were removing it. This time it was more of a sticky substance, more liquid, which means that it would assume that the treatment that I am on is working, and it's causing it to fight itself on the inside out. I am doing pretty well now. I go tomorrow morning for another treatment, and then I don't have to be back again for 3 weeks, so this is my long break, thank goodness. And I'll just keep you guys updated on how everything is going. And like I said, don't worry about this tumor that looks like it's huge and it keeps growing. It's not growing, it's just swollen, and I'm not really in very much pain except from my post-surgery site, and I can be blamed for that too, because I just don't really do a whole lot of self-care, because I always want to go and be part of everything, and I need to start realizing that I need to take care of myself first. And if I'm not feeling the greatest, I need to stay home, because in order for my immune system to work properly, I need to take care of myself properly. So I just want to give you guys a little update, and if you have any questions for me, feel free. And yes, this is my real hair. This is not a weave or a wig for once, so that's a plus. My hair is long and it's growing. Alright guys, thanks for thinking about me and watching my video. I'll talk to you later.